welcome to Hey Nurse, where we strive to impact one, change many. And in today's video, we are talking all about my personal experience of going from a new grad RN/BSN to an ER nurse. But first, make sure you subscribe, like, and comment on this video and keep coming back for more, okay? So yes, when I got out of nursing school, I decided to go into the ER, which is where I stayed for the first about 4.5 years of my professional RN career. Okay, so let's talk about how this even happened. When I went to nursing school, I thought that I would have been a labor and delivery nurse or going into pediatrics. And then when I went through my clinicals, I just could not take those experiences. I couldn't take, it was more so the family situations, not just the client or patient, but the families around those situations, you know, child abuse and stuff like that, and having to be a mandated reporter and really witnessing those experiences. That was a lot for me in nursing school. Now, of course, as I have been through so many more experiences, I see the world differently, but back then it was something that made me say, oh no, I gotta figure something else out. That's not gonna work. Then I was left with, okay, so now what I'm gonna do? I'm about to graduate from nursing school, what am I gonna do? So prior to going to nursing school, I worked in hospitality. And so I was used to that fast-paced environment. And so then I'm like, well, what about the ICU or ER? And then so when I did my preceptorship in my final year, it was in the ICU, and it was a good experience. I figured, well, let me go on over into the ER, because that whole fast-paced environment, on top of, I knew, or I had heard that that area had the potential to make more money. So then I'm like, that's another plus. So those were really the factors that steered me in that direction, was that I thought it was a good match for the experience I already had, along with the potential to make money and to grow. Now, in regards to the first year, it was rough, honey. It was rough, okay? Within the first 6 months, I was ready to be done with the whole thing. I'm like, why did I do this to myself? I don't want to do this. I don't want to be here. I don't want to do this. So let me tell you about how the whole orientation thing went. So I had a really good guy who was my preceptor. The only drawback was that at that hospital I was working at, they had different crews, like an A crew and a B crew on certain days. So you knew what your schedule was, because it just flip-flopped every week. And you pretty much was on the A or B crew, unless you end up working like a split shift or a mid-shifter, which was like the 3 p to 3 a.m. Or 11 a.m. to 11 p.m., which was me also. Anyway, but who I did my orientation with, when I completed it, I was switched to another crew. I was switched to a crew on the opposite days. And also, by me being a mid-shifter, I got 2 separate crews on the opposite day, if that makes sense. So basically, the people who I grew in my first few months of becoming a nurse with, well, I don't have these people to have my back anymore. When I got to the new people, I feel like they're like, hey, what's up? Which rooms you got? All right, bye, peace. You know? So that was different. It was different because, again, when you build relationships with people, they know what your strengths are. They also know what your weaknesses are. They're able to kind of maybe work with you a little bit, and then whereas for me, going into a whole new crew when I finished, it's like we had to start all over with learning again. And again, by me working the split shifts, that's also something that was, well, to me, the shifts was a benefit to the ER, because unlike other units where you may have to work a 7 p to a 7 a.m. or a 7 a.m. to a 7 p, again, you have those split shifts. And then as I got better and became PRN and all of that, life really changed, because I just started making my own schedule, and you know, they were just happy that I would come in whenever I would come in to help out and stuff. But again, that was way later. When I first started, it was the mid shifts, and mostly 3 p to 3 a.m. Which, whew, again, I had never worked night shift before becoming a nurse. So learning how to stay up at night and what it meant to have to sleep the next day, or I would sleep the day before, and having a grocery shop and pack for all of those days, like it really was kind of a lifestyle change. And when I got off of work, like I literally would do nothing. Like I would take my child to school, my husband would go to work, I would sleep, and when I got up, I would binge watch Netflix. Probably the first year, like definitely. Like I just needed a mental break, and that's what I did. And I mean, I would hang out with my friends, but I had a lot of quiet days to myself where I would just have to recuperate from what I just went through, because it was definitely a lot. However, even though I wanted to quit within my first 6 months, I didn't, and I actually did stay for the first year. As a nurse or a new nurse, a lot of times people say you should stay with your employer or wherever you're at for that first year. You should stay there. And so, and I kind of see pros and cons to that. Yes, you can stay and get the experience, but then a little piece of it is you're losing time. And you know, if the place really sucks, it's awful that somebody would stay in a position that sucks if you're completely miserable just because somebody else's advice. Whereas you can go to another hospital and be, or another unit or something, work with a different set of people that could really change your outlook and really renew that passion and love again. So I don't know if I agree with just stay there and take it, just stay there and deal with it. Now the flip side is I do see, okay, kind of get your skills, because so I didn't leave in 6 months, but again, once that year hit, I was done. And when you do start somewhere else, again, you have to start over, learning people, learning the hospital phone numbers, learning how the building is set up, and where's radiology, where's MRI, you know, how do you get to the elevators, like those little things that people kind of take for granted, where supplies are, those kind of things, because as a nurse, time is always ticking. It's better if it doesn't take me 5 minutes to figure out how I can call a hospitalist, or you know, if I need a social worker, what's that process? Like I already know what I need to do. I don't have to leave from my area and go ask the charge nurse and stuff like that. So in starting in a new place, you do have to cross over that hump of, you know, everything's new versus being somewhere where you're familiar with the environment and just improving your skills. So I can see a little something there, but again, you know, I don't know, personally, if somebody left in 6 months, I wouldn't be mad at them, because it's just like some of these places, the way that some of these places run is not always the most efficient. And you know, sometimes people keep people in positions because they're prioritizing other more acute, I guess, needs for the unit, but sometimes that doesn't mean that the unit is flowing very well. So anyway, I just feel like, why hinder yourself because of somebody else's shortcomings? And that's just being honest. You know, this is, in my opinion, for me, it was my professional career. So anyway, I knew I had to make a change and do something different. I was very happy whenever I moved because of the new experience, along with the sign-on, no, I didn't get the sign-on bonus, actually, now that I think about it. I didn't get the sign-on bonus because you had to have 2 years of ER experience, and I only had 1 at the time. So, but anywho, I did get somebody else on and then got that referral bonus. So in that time, again, between year 1 and 3, 4, and so on, I really did improve in my nursing skills. So the tasks that I had to do, like Foley and IV and NG, all of that stuff, along with my communication skills, and both, like, it's so amazing, like, comparing like where you started to where you end up, because like the change is just drastic and it's slowly built day by day. So originally, like I had worked as a nurse tech on a spinal cord injury floor, so some things I was familiar with, like I would watch the nurses do teaching of self-catheterization and whatnot. And then of course vital signs, I did that as a tech and stuff, but like in IV, I had never started that while I was in nursing school, so I had to learn on the floor. I mean, of course we went through the skill and I had skills checkoffs in nursing school, but in terms of starting an IV on a real live human being, nah. In the beginning it might have been a little rough, and I would get it down packed for a couple of days, and then one day just have a whole day of not being able to get anybody, and it's like, what happened? I did this fine the other day, what happened? It's just building that confidence, and people put you on the spot. Soon as you, especially me, because I look young, so people be like, you know what you're doing? That's the first thing. How long you been doing this? You good at doing this? I think you need to get somebody else. So you start learning again that communication piece, because as a nurse, it's like your mind is thinking in so many different ways. Like you're thinking about what you need to do. You might be anticipating orders. You're trying to respond to the client and their family members, and just it's so much that's on your mind, and that's one little patient set, along with having to take care of your other load. So it's just a lot that be on your mind. So to be able to effectively communicate, be able to do the task again, from putting inserting the Foley and maybe getting a urine specimen, starting the IV and drawing blood, if it was blood cultures, like just really getting those skills and processes, getting organized, was definitely vital and key to me growing in those first few years, because as I began to be able to read a triage note and know, okay, we about to order blood, again, IV, we need urine, you know, we want to see this, like put them on a heart monitor. Like as I was able to know what I needed to do already, especially if I knew the doctor and how that doctor typically ordered, I was rolling with it, you know. So it definitely got better over time, and in all honesty, I'm so glad that I persevered. I'm so glad that, you know, I didn't give up and throw in the towel even when it was rough. You have long days, and especially by, you know, if you're working 3 12s and then you start adding on day number 4 or 5. See me, my cutoff was 3 days. And even on the 3rd day, mine got a little rough, okay? And as the people of the world say, I needed to be able to hit it and quit it, okay? I needed to work some shifts and be done with it, okay? Also, another skill that I improved on was that prioritization. Anyway, prioritization, because again, I would be able to take on my 3, 4 patients and then know, okay, I need to go see this one first. Then I'm gonna go here. You know, when I go into this room, I'm gonna bring A, B, C, and D. Like I was able to prioritize what was the important needs. And even as I began being a float nurse on the floor, who needs to go where first? Which orders needed to be taken care of first. It depends on so many different factors. How long was it going to take me to do something? How many resources did I need to make something happen? You know, if it was an IV, is this someone that was a hard stick or an easy stick? And let me go back to those IV skills. I went from having rough days starting an IV and days where it's just like, where did the skill go? I thought I had it down packed, to being the person called into the room, being the person getting those tough sticks. I mean, I would get them on people's fingers and their chest, like wherever I could, following hospital policy. I did, we figured it out, okay? And again, that helps because then your charge nurse knows that, oh, okay, this person is most likely to go get the job done. So between being able to get blood on somebody that they couldn't, if it was a baby that came into there, well, I'm able to start your IV. And in fact, I thought the babies were actually a lot easier than, I think it's just more that they're small, that people get like a little intimidated. But it is really not that bad. Once you stick them, they might cry for a few seconds, but they're mostly okay. It's the parents that, you know, sometimes go to having their own issues that they have to work through because, you know, they feel like the baby's hurting, so they feel that pain and whatnot. So just having to manage them and the child is something. And again, that goes back to communication. So how the communication skills for me improved was, I was just a regular person. I was a regular person that had to learn how to talk like a nurse. And so regular me might have asked someone, you know, say if I had to obtain urine from a patient or from a client, I may say, oh, do you think you can give me some urine? And I learned to stop doing stuff like that, because if I asked them, do you think you can do it? Well, they literally answered the question I asked, which was, no, I just went to the bathroom. I know I went before I left here. I'm trying a little bit. Whatever they felt like telling me, most of the time it was no when I asked it in that form. So what I had to learn how to do was say, hi, my name is Megan. I'll be the nurse taking care of you today. Part of your orders is that you have urine, so follow me to the restroom. And I'm already waving and giving body language that's going with what I'm saying, so we're already going there. It's not really a conversation. I'm directing you to what needs to happen, because again, this is a hospital setting, so we need certain things to get done for us to be able to give those results. You know, if you want to know what the problem is, we got to rule out a couple of things. The only way to be able to do that is once we have some results, once the doctor assesses you, once we look at all this stuff, then the doctor can make a diagnosis. We can move forward from there. You staying, you going, what you doing. But again, learning that process, learning how to communicate in those moments, it really did take time. And again, I'm so thankful that I took the time to learn. Again, I'm thankful that I stayed with it. I mean, I might have had to pray my way before and after, even during, but I'm so thankful, honestly, that God just kept me in those moments and stuff. And that's a really big part of it. I mean, I prayed when I was in nursing school, but once I got out, like it went to another level, because, you know, I started praying for my patients, and then praying before, again, I went to work, like just asking God to bless me and help me to bless other people, help me to not cause harm or hurt anybody, because that's never ever something that I wanted to do. So you know, I just asked that God would cover me whenever I went out to work and whatnot. So and then praying kind of for co-workers and situations, as you know, you have certain tough times and addressing situations, like just praying through that. That was like a big that was an area of growth for me. So I definitely learned what it meant to sink or swim, because it literally, you'll be thrown into a patient assignment and you just gotta go figure it out. Like sometimes you have people that was able to help, and then sometimes it's just you and these clients, and you gotta figure out what you're supposed to do. And I mean, they are, according to your license and according to the documents you signed, you said that you know, I said that I would be able to do this job, so therefore gotta perform. Definitely had to learn how to swim. I might have had to doggy paddle a little bit here and there, but baby, we were stroking with it at the end. Okay. Also learning, fake it till you make it, because again, like I said, people put you on the spot, you know, and as a nurse, sometimes you can learn a skill and never do it again for like 5 years. So between that and it's always new technology, new procedures, nursing is forever changing and growing. So you're always constantly learning. So again, to me it was more about developing confidence. That's the word I would look for. I would say too, with the communication skills. Like I learned how to be confident in my answers and my responses and my dealings with people. And not take such a backseat approach. And again, it wasn't about, oh, I'm not a confident person, because baby, do you see me? Okay. It wasn't about that, but it was more about being a confident nurse. And so whenever you don't always know the answer, don't always know what to do, who to call on, when you have to kind of make some choices, or you're wondering, should you address a certain situation, sometimes those can be tough calls. But again, I learned I had to do what I had to do, and I felt better discussing what was on my mind than just keeping it. And actually, for the first few years, I kept a lot on the inside, or I talked like with my group of friends. We would go to lunch or dinner and talk about things. But I have learned over that time, especially me now, I wouldn't even play all them games, because mentally my mind got to be clear. I got too much I need to do, and I'm trying to hustle to be sitting there stressing about how a situation went and replaying things in my mind and thinking this, oh, I should have said this, no. So, and I say that because the inner team aspects of you working with other nurses, that was also a big learning step for me. Again, I talked about it before, where I switched from one crew to another crew and then worked the mid shift. So then I got the best of both worlds, because I got the daytime and how they run things, and the nighttime and how they run things differently. So again, the great part about that was that I gained lots of experience, because I understood why people made the choices that they made. I saw different approaches to things, and then so now it helps me because I feel like I'm way more flexible, able to adapt, able to come up with solutions. That's the type of skills that are valuable as an ER nurse, and that's why whenever ER, ICU, or just anything critical care is on a resume, people know, oh, okay, like that's a loaded something, because I know that you come with all of this with you. Like you have all of these good qualities with you. So overall, by the time I was towards 2 and 3 and 4 years into it, I started precepting students and other new nurses. I worked all areas from triage to the fast track to trauma to main ER bed, and every now and then, I would have the psych rooms and whatnot. But the first hospital I was at, that was a whole separate unit. And then even the second hospital, they had a specific psych nurse. So it was more like everybody else would be like the medical nurse, and then you had a psych nurse that would double up with you on those patient rooms and whatnot, if that nurse was available. And each area is different, because again, your triage nurse, having to learn what's the protocols that I have to do up here. Somebody presents with chest pain, okay, then I have a certain amount of time to get an EKG, depending on what the hospital policy is. Certain amount of time to have them back to a room. It just depends on what's going on, what's the age of the patient. All of those things are factors. Again, like I said about the whole experience piece, I just think it's so many things that's embedded into someone that it's just unconsciously done. But again, this is why whenever you see ER on someone's resume, or they talk about that background, it has a lot of weight, because you truly gain so much in those moments. Maybe fate had me there, but now that I have done it and life has passed, I don't think that it was by accident. I think everything that I have been through and all the experiences that I have gained really are working together for the greater good of myself moving forward. So I'm so happy, actually, in making this video. Now that I think about it, I really am happy about what I have learned in this time and choosing that path It might have been scary in the beginning, but I'm really happy with who I have become in going that direction. And not to mention, I did make some nice money between raises and differentials and everything else. That's another video for another time. But I hope that this video has blessed you and really given you some answers if you were seeking insight. If you have any questions, leave them below in the comments section. Again, the goal here is to impact one, change many. Again, my name is Meg, and make sure you're here for the next video. Peace.